Hello everyone and welcome to today's WorkSafe Tasmania Month webinar. I'm Stephanie from WorkSafe Tasmania. I would now like to introduce today's presenter, Kelly McInnes from University of Tasmania. Kelly is a current PhD candidate with the Tasmanian School of Business and Economics at the University of Tasmania. Kelly has research experience related to physical and psychological injury or illness, with research projects focusing on workplace conditions, return to work experiences, and overall return to work outcomes as a result of these experiences. Kelly has additional research experience in the occupational rehabilitation space, providing research expertise in the proposed new framework for workplace rehabilitation providers in Tasmania. With a background in psychology and human resource management, Kelly blends both disciplines to focus her research in the occupational rehabilitation space. Welcome, Kelly.
Good afternoon, everyone, and thank you, Stephanie, very much for the introduction. As Stephanie said, my name is Kelly McInnes, and I'm a PhD candidate with the Tasmanian School of Business and Economics. Today, I'm here to discuss my doctoral research, return to work experiences following physical or psychological injury, experiences of Australian employees. Some of you may remember me from last year, and if you do, that's brilliant. Last year, I had the privilege of presenting my research at WorkSafe Month. I presented a highly theoretical and conceptual presentation that was outlining all of my objectives for the research, so why we needed it, what variables I would look at, as well as how everything was so intertwined. Today, however, is going to be slightly different. Yes, there's still some theory here, so there's still likely to be some academic jargon, but today will be a platform for me to discuss preliminary results of the research and some of the topics that I've come across within that. So firstly, I would like to have a quick acknowledgement of country. Today we are meeting across Lutruwita, Aboriginal land, sea and waterways online. So I acknowledge with deep respect the traditional owners of this land, the Palawa people. I pay my respects to elders past and present, and to the many Aboriginal people that did not make elder status, and to the Tasmanian Aboriginal community that continue to care for country. I'll start my presentation with words from one of my participants. You know, the deeper you dig, the more horrified you're going to become. I want to reflect on this because this quote sticks with me for numerous reasons, of course, but my participant was right. The more stories I heard, the more experiences I discussed with people, the more saddened I felt that people had had such struggles trying to return to work. I thought that I would only hear of some negative stories and negative experiences, but the more I heard, the more I realised we just aren't quite sure how to help with return to work. I wish I could say that this was just one particular sector within one particular state, but it's not. Today, you're going to hear some things that will shock you. So I want to premise this presentation with a content warning. Some of these topics discussed today you may or may not find distressing. If this is the case, please do not feel obligated to stay. As I said, there are some heavy topics discussed within this research, and I by no means will take anything personally if you need to take yourself away from this presentation. So before I get into the preliminary findings, I'll provide a quick recap into questions that I was aiming to answer. So as you can see, I have quite a number of research questions that I wanted to address that covers a really large range of variables. So these include things like social support, resources, resource depletion, stress, job accommodations, supervisor competencies, and I also wanted the ability to explore individuals' experiences based on physical or psychological injury or illness. Now, whilst it's not possible for me to cover the entire preliminary results of my research, I can provide a brief overview of some of the findings, and I can slightly delve into each of these. So last year, I also described a very complex research design. This research design was using both qualitative and quantitative research that was measuring things at multiple points in time. But thanks to COVID, as well as difficulties recruiting, the research design was altered. So originally, I had a grandiose idea of collecting mixed methods data that had surveys as well as interviews. And I had originally anticipated collecting that at 4 separate times of the return to work experience, with about 24 participants in total. We ran into some extreme difficulties with recruiting, so I completely overhauled the research design. So I removed the quantitative data aspect, leaving it to be a retrospective qualitative research design. So this was a research design that then recruited participants that were either yet to or unable to return to work, or people that had returned to work within the last 2 years. I then ramped up my recruiting and used paid Facebook advertising to get the word out there about the research. And I had the intention of recruiting as many participants as I possibly could. I ended up recruiting a total of 15 participants with a total of 23 injuries and illness. Now, as you can see, these are quite broad in their nature. So the physical injuries and illnesses included things like ruptured ligaments, tendons, and nerve damage. There was a motor vehicle accident where a participant had been hit by a car. There was a lung injury due to a machinery accident. There were workplace assaults, traumatic brain injuries, including post-concussion syndrome. There was a participant with end-stage liver disease, which led to a liver transplant. And there were also participants that had cancer. So these included breast cancer and follicular lymphoma, which is a form of non-Hodgkin's lymphoma or blood cancer. The psychological injuries and illnesses covered were also very broad in nature. They included anorexia nervosa, post-traumatic stress, adjustment disorder, depression, anxiety, workplace bullying, and chronic pain. I spoke with 11 females and 4 males from multiple Australian states, so people within Tasmania, New South Wales, Queensland, Western Australia, the Northern Territory, and the Australian Capital Territory. There was also a diverse range of industries that participants came from, so places like Child Protection Services, Department of Defence, Department of Education, Transportation, Administration, aged care, the telecommunications sector, people within the mining industry, so fly-in, fly-out workers, people working within local governments, a phlebotomist, which is someone that works in pathology, and quite ironically, someone that worked for workers' comp. Now, as I said, I can only cover so much today, so I thought it would be really insightful to look at job accommodations and what could be beneficial when these are provided, as well as what can happen when it goes wrong. So as you know, accommodations are made for an injured employee to assist and facilitate their return to work. The figure that you can see on the slide is a list of job accommodations from the Job Accommodation Scale by Shaw and colleagues, and it shows a list of accommodations that could be provided for return to work experiences. Each accommodations that have highlighted boxes around them were provided to participants in the study. Interestingly, but not surprisingly, there were more accommodations provided for physical injury or illness, as you can see by those green boxes, than there were accommodations provided for those with psychological injury or illness, which is outlined in the orange. Now, 1/3 of the total accommodations listed by Shaw and colleagues were provided for physical injury and illness, and these were really beneficial to participants. The provision of these accommodations left them feeling really supported in their return to work, and it was reported to be extremely beneficial. It's worth noting that 1/7 of the total job accommodations were provided to participants with psychological injury or illness. Now, these were still commented as being really beneficial and supportive, but there weren't as many accommodations provided for those returning to work following psychological injury or illness. Now, moving on to a lack of accommodations or the provision of completely inappropriate accommodations. I spoke with a participant that had a diagnosis of anorexia nervosa and associated physical conditions such as poor heart health. So following a hospitalisation for this diagnosis, this participant worked incredibly hard with their extended healthcare team to get to a point where they could return to work. However, she was required to agree to a number of conditions in order to return to site. So these provisions included having to have what they coined a personal accountability buddy that followed her everywhere. And when I say everywhere, I mean everywhere. They followed her into the dining hall to watch her eat. They followed her into the toilet and listened to her on the toilet to ensure that she wasn't sick. They were monitoring her access into the gym and heavily restricting that access. She was required to show her supervisor her food log, which is something that she only shared with a dietitian, and she reports as something that was incredibly invasive. And she was also required to provide her supervisor with a list of all medications that she was taking. Just imagine what that experience would have been like. You can also see a number of quotes where there was a complete lack of accommodations provided to some participants. I spoke with another participant who was hit by a car. She ended up admitted to hospital and then discharged, and subsequently admitted again days later following a debilitating headache. She ended up in intensive care, and her supervisor, who did not believe that she was that unwell, required her to send a photo to prove that she was in the intensive care unit. Not only this, but that same supervisor also informed her co-workers that she was on holidays for 4 weeks. So upon her return to work, no one even knew she was severely injured, let alone the extent of those injuries. This left her feeling completely isolated as she struggled with the aftermath of being hit by a car and her post-concussion syndrome. Given the extent and side effects of this post-concussion syndrome, which included difficulty concentrating, the inability to balance. In fact, she failed a balance test performed by treating physiotherapists, and depleted energy. She requested from her supervisors a 4-day work week. The idea behind this 4-day work week was that the 5th day would be a rest and recovery day, in addition to some rehabilitation therapy to help overcome the post-concussive syndrome. Despite having all of the recommended documentation from a medical team, this request was yet to be endorsed at the time that I spoke with the participant, some months after returning to work.
Just before you move on, Kelly, a question, are these all work-related injury and illnesses?
So some of these are work-related injuries or illnesses. The participant that had the motor vehicle accident was on her way home from work. Some of the injuries or illnesses have occurred outside the workplace but are still required to return to work. So I asked all of my participants what they wished they received from their workplace. And these were some of the themes that arose. So support was one of the biggest themes discussed. As you can see, there were some participants that were suicidal as a result of their injuries and were really struggling in their return to work because of that sheer lack of support. Unfortunately, of all the participants I'd spoken to, there was only 3 participants that reported a positive return to work experience. So out of 23 experiences, only 3 were positive and only 3 felt supported. It's important to note that there are 2 types of social support, and those are perceived social support and received social support. Now, the difference being perceived social support is the social support that individuals think that they're going to get, whereas received social support is the social support that they actually do get. Both forms of social support can have a positive impact on an individual, and they can buffer against different sources of stress.
Just another question that is, sorry, another question that's come through, Kelly. Did any of these persons have a workplace rehab provider appointed to assist with return to work?
Some of them did, yes. Yeah, some of them did, and I'll be discussing some more about that very soon. So, as I stated, there were individuals that reported that they did receive social support and that this was really beneficial to them. And it wasn't just social support from their family or friends or children or partners, it was also from the department in which they worked. There were also instances of a lack of social support. So participants noted that if there's a lack of support, then some individuals might lose their life. And they're right. If there's a lack of support, whether it be perceived or received, that can add to feelings of isolation and feelings of suicidal ideation. And that's pointed out by the next quote of how an individual was left to feel when their employer didn't want them on site. And again, when another participant found out that their injury was used to get out of a tenancy agreement of a building. And this same participant knew of 2 other people that injured themselves in the same way and nothing was done about it. Another variable that I wanted to focus on was the role of supervisors and co-workers. So Johnston and colleagues have conducted a study that identified around 84 competencies that were required or would assist supervisors to successfully manage return to work or work reintegration processes. Now, not all of these are present within the study. In fact, there only seems to be the discussion of support from supervisors. So firstly, I want to discuss some of the positive experiences because there are some. I know that as I present it seems all doom and gloom, but there are some instances of positive return to work experiences. And there have been participants that discuss having those constant communications and check-ins with their supervisors during their return to work experience. And they've outlined the benefits that this had on their return to work and ultimately contributed to the successful return to work outcome. But unfortunately, there's more instances of where this goes wrong. So I spoke with a participant that had a traumatic brain injury following a fall. This participant informed me that they were asked to return to work within 2 weeks. Now, this participant had to relearn all of the basics, how to walk, how to talk, what to wear, and what was appropriate to wear, even reminders to do the simplest, almost automatic tasks like drinking water. And ironically, this participant was working within the workers' compensation sector. This participant reported being yelled at for making a coffee prior to a meeting, as well as having to write down all the details that occurred throughout the meeting. This was part of a recovery process because she was having difficulties with memory. This participant also had to continually use medical certificates to enable her to recover following her brain injury. This participant still experiences difficulties with her return to work, given the extent of her brain injury, and still has difficulties with different parts of her work. There were other participants in the study that both worked within the same department, within the same state. Both had some really negative and harrowing experiences. So one took leave following some stressful work-related circumstances, and despite having all leave entitlements and following a GP's recommendation, their leave was questioned by their supervisor, which of course caused additional stress. So following this, the participant filed a workers' compensation claim. And this participant told me that there were many issues and difficulties that arose with an injury manager, to the point of stating to me that I was likely to hear about this person again. And this participant also experienced a workplace assault as well, which resulted in an additional workers' compensation claim and a knee surgery. This participant has not yet returned to work, given the impact that this injury manager has had on them. Another participant spoke to me about this injury manager and the impact that this injury manager has had on their return to work. So this participant was subjected to years of workplace bullying, and I'm talking systemic, over a decade of bullying and harassment. Initially, this occurred by a number of co-workers, but the participant indicated that both formal and informal leadership within the organisation had supported and even rewarded those co-workers that participated in the behaviour. So this participant was then put into a position where they were required to work with the individuals that were bullying her. When she was speaking with the injury manager about the experience, she was understandably quite upset. The injury manager had informed her that she should be medicated. This injury manager that had been discussed was referred to as someone that was not caring about other workers, only the outcome. It was reported that this injury manager fought absolutely everything, to the point where a participant's GP told the injury manager that they were not to have direct contact with this participant, but that was ignored. Quite alarmingly, there was reports that this individual is completely unable to handle individuals that are returning to work and individuals that are vulnerable. One participant told me that she knew of another individual that spoke with this same injury manager and then spent the afternoon crying because of how they were treated. And one of my participants had extensive documentation that was just outlining all of these behaviours that were from the injury manager and the inappropriateness of these actions and the impact that it had on her. There was also reports of negative co-worker responses to injury and workers' compensation claims. So I spoke with a participant who really unfortunately had numerous injuries. There were about 6 or 7 in total. over a 10-year time frame with the same employer. So these injuries included at least 3 surgeries to help with those injuries, so 2 knee replacements and a surgery to fix a shoulder. And there was a psychological injury as a result of everything that the individual had been through. So those 10 years of injuries, including an almost suicide attempt in a dissociated state. So this participant explained that he would experience his co-workers telling him to get off workers' compensation because that would send the employer broke and everyone would lose their jobs. Now, to provide context, this employer is a nationwide employer that provides an essential service and has large profits. So they're not likely to close down. However, they're still creating a culture where co-workers can bully those on workers' compensation. I also looked at experiences based on psychological or physical injury or illness, and the comments were all relatively similar in that there is a lack of understanding into psychological injury or illness. Not only this, there seems to be a lack of understanding in returning to work following brain injuries as well. When looking at physical versus psychological injury or illness, there was more conversation around the injury or illness being invisible. So if you have a broken arm or if you have a broken leg, it's visible. To others, there's a clear connection between the injury and the return to work. With invisible injuries, whether they be brain injuries, psychological injuries, or even cancers, there seems to be that disconnect and that lack of understanding. Unfortunately, it seems as if because it's invisible, it's often forgotten. You can't really forget about a broken leg because you can see someone on crutches, but if someone looks to be in good physical health, then they're assumed to be okay. And this was a large theme within the research. I also had participants that experienced the negative side of workers' compensation, where participants would talk about having to battle for their claims to be accepted, where they reported that their organisations accepted liability for these injuries or illnesses, but then bullied them or belittled them or dehumanised them. There were comments around the perception of workers' compensation and how there seems to be more difficulty when applying for workers' compensation for a psychological injury or illness, and the troubles that are often associated with that. There was also discussion of the stigma that surrounds workers' compensation. So one participant told me that there's almost this unseen expectation that when someone is on workers' compensation, they're not going to return to work. There's this perception that they would rely on payouts for the rest of their lives. And this participant noted that he experienced this feeling and that people were surprised when he wanted to go back to work. He also stated that there just seemed to be an expectation that because he was on workers' compensation that he wouldn't return to paid work.
Just a question, Kelly. How many physical injuries did you have reported that escalated to diagnosed mental health injuries, and how many felt that this was contributed by the lack of return to work support?
There were a number of participants that had physical injuries that ended up with secondary psychological injuries. There would be about Four that can immediately pop into my head. So there was quite a substantial amount. And there were also additional participants that were experiencing psychological illness as a result of the process of their return to work process and that lack of support as well. So the two definitely seemed to coincide. Organisational culture was another huge theme that arose. So there were discussions with participants around poor organisational culture and how this can create as well as exacerbate any kind of injury or illness. So participants talked about being another number to the company or being a cog in a wheel or a thorn in someone's side. This discussion kind of outlines the poor organisational culture when it comes to understanding injury or illness and the implications of this. Now, it's really important to note that we as a society are now shifting from placing the onus on just an individual, that illness is not just on the individual, but focus is shifting to the environment and those psychosocial risks that can impact an individual and how an environment such as a workplace can potentially impede an individual. So this is really promising because it demonstrates that shift in focusing on what's wrong and psychopathology to understanding how we can improve external factors, such as how we can improve environmental demands to help an individual. Now, unfortunately, with some organisations, it's not going to be that simple. There's such as working within the Department of Defence. There's a hierarchy and a rank, and the participant was expected to follow suit. So the participant working within the Department of Defence was expected to follow their supervisor without question. And in the event that they did question anything, they were ostracised or shunned. And unfortunately, this is exactly what happened with one participant. This participant is now feeling like she can't return to work at all without having to fight any form of bias or judgment because of her supervisor's response to her injury. Now, I know that as soon as COVID-19 pops up on the screen, there is some form of internal groaning. I understand that we've heard it all, that we've spoken about COVID non-stop over the last 2 years. But COVID had a really large impact on this research in more ways than one, and it has a really large impact on return to work. So some participants were required to work from home. This was for a variety of reasons, some because there was access issues, but others were through being immune compromised. Some of these participants reported feeling left and unsupported throughout the entire process, not only having to navigate through not just the pandemic, but from working from home alone and how that looked. COVID also impacted recovery processes. So we all know that COVID impacted surgeries or it pushed back surgeries, but they also affected individuals' recovery and rehabilitation. So participants reported to me that they were losing muscle strength and the inability to function because of strict guidelines and procedures regarding COVID. There were participants that couldn't even go to their physio because there were such strict guidelines surrounding that. Another one of my participants discussed how she was required to work from home since COVID had begun. And she also mentioned that she was made redundant via Zoom. Let's just let that sink in for a minute. Just imagine being at home, alone, injured, working from home in a pandemic that no one at the time knew anything about. and then being made redundant via a video call. That participant had a very, very difficult time following that. Fortunately, believe it or not, COVID did have some positivity. And I don't say that to minimize all the negativity that's associated with COVID, but COVID normalized working from home. It promoted flexible working arrangements and it promoted adaptability. How quickly have we all had to learn how to video conference or use Teams or use Zoom? We now have webinar conferencing that allows everyone from Tasmania or Australia to be involved rather than just presenting face to face. Now, before I conclude my presentation, I want to quickly provide some other considerations and themes that arose through my research. The first is treatment trauma. We need to be highly aware of the treatment trauma that individuals may or may not experience. Treatment for particular injuries or illness can be incredibly traumatic for an individual, which may mean that they're at higher risk of distress when returning to the workplace. We need to be more trauma informed rather than adding more pressure, more uncertainty, more inappropriate actions or conditions that could hinder an individual rather than help. The participant that I spoke about earlier that had anorexia nervosa ended up developing post-traumatic stress with depression as well as a result of the inappropriate conditions that were placed upon her following the treatment that she'd already got in the hospital. Toxic positivity does exist. The best way for me to describe this to you is explaining one of the participants' experiences. Now, this participant was undergoing chemotherapy for follicular lymphoma. So that type of chemotherapy looks a lot different than the perception you may have of typical chemotherapy patients. So she described that she wasn't losing her hair or looking like she was undergoing chemotherapy, but she was incredibly fatigued. She would be in meetings where she would struggle to keep her eyes open, but she had her co-workers telling her that she just needed to remain positive and that if she was positive, everything was going to be okay. She also had participants ask if she has taken her vitamins because her vitamins would help her. Whilst this was well-intentioned by her co-workers, it was not seen as helpful, and it isolated her further. It was very difficult for her to then explain the things that she was going through and the kind of assistance that she needed when people were just telling her to focus on the positive and that everything will be okay. We need to strike this balance between being positive and hopeful for someone with being realistic. And this coincides with the point of return to work following an incurable disease. So we lack the knowledge, and there's not been a lot of research on how to facilitate this kind of situation. Generally speaking, we just assume that there's this start point and this end point or finish point of a return to work process, or even a start point or an end point of an injury or illness. And that's not always the case. There are going to be instances where injuries or illnesses are incurable. So we need more research into this area to figure out how we can help individuals that are returning to work but don't have that end of injury or illness in sight. And lastly, but certainly not least, is that return to work processes are not linear. There is no one size fits all approach that can be taken with individuals that are returning to work. It's not a stock standard 4-week process and everything will be back as normal or as pre-injury or illness. There are peaks and there are troughs. There is re-injury at times. At times there is secondary injury or illness. Return to work can be incredibly stressful and it can be incredibly messy at times if not handled correctly. We need to focus our return to work on the individuals undergoing the process rather than trying to apply this one size fits all measure. At the moment, we're almost trying to fit a square peg into a round hole, and it's time that we start changing our perspective. And as I mentioned earlier, we are starting to focus on more than just the individual. We're starting to focus on the environment and psychosocial risks and how we can assist individuals in creating a healthier, safer workplace. I'll end my presentation exactly how I started, and that is with words from a participant. I don't want anyone else to have to go through what I did and still going through it. This concludes my presentation. I want to thank you for your time and the time to listen to my participants' stories. I finished early as I thought there might be some more questions, so I'll open the presentation in the event that there is any more. Thank you.
Thank you very much, Kelly. So if anyone does have any other questions for Kelly, and we'll go through some other questions that came through as well during the presentation. So a question, if someone does or has a non-work related injury, why is it up to the employer to accommodate them? Is it if it's not work related?
Even if it's not work related, if not accommodating particular injuries or illnesses, you risk exacerbating the existing injury, as well as risking a secondary injury or even a tertiary injury following that. So if individuals are not feeling supported within their workplace or feeling like they're being accommodated when they're going through a mental health condition or a physical injury, that can lead to further difficulties that arise that then are a result of the workplace. So it's more a preventative measure, even if it is outside of the workplace, by assisting individuals returning to work following any kind of injury or illness.
Oh, thank you. In your investigation, did you discover cases where the person who returned was treated fairly by the company, but fellow workers did not? The fellow workers treated the person in the way that, treated the person in that way as he was always on light duties, etc. Yet when on the weekends he would be camping using chainsaws, cut wood. This behaviour leads to this animosity. What can the company do about this?
That's a very difficult question. I did not come across anyone that was being supported in that way with light duties, but would then go and do those kinds of activities on a weekend. I suspect if that's happening and there's instances of that happening, there really needs to be an open and honest conversation about what's occurring, as well as how to respond to it appropriately. It would be a very difficult situation for a supervisor to be in. And I do understand that there is animosity within workers' compensation or individuals that are injured, and this is why. These instances are why, unfortunately. But not everyone is that way inclined, and not everyone that is on workers' compensation or on those lighter duties are doing what you are saying that that an individual has done. A lot of people are trying to get through their injury and return to work. Most of them want to return to work. If they don't want to return to work, it's because they're not capable, and they understand that they're not capable of being able to assist.
All right, thanks, Kelly. There's still time to submit your questions via the control panel. Please type them in the questions window, and Kelly will answer them. So another question, are we allowed to inform the other employees when something occurs to them, or does that breach confidentiality? It's difficult to sometimes know what to do.
Again, that's a really good question. Sometimes it is really difficult to understand confidentiality and when you should be discussing this with other people. The biggest suggestion that I can make is to talk with the injured or ill employee and ask them if you're able to disclose it, if they want you to disclose it, or if they don't want you to disclose it. Ultimately, if they don't want you to disclose that to anyone, then you need to respect those wishes. But if they do want you to, then ultimately you can. But again, that's another conversation that has to be had. And by having those conversations, you're able to then figure out better ways of approaching those things.
And this is probably just a comment statement that's come through, Kelly. In Tasmania, state service employers are subjected to Employee Direction number 29 of the State Service Act, managing employees absent from the workplace.
I did not know that. Thank you.
Question. Did you see good links between HR consultant and return to work coordinator where cases were well managed, such as an environment being managed to provide a safe workplace for the person to return to?
Yes, I did. With those positive experiences and with those successful return to work outcomes, everyone was on the same page. So this was external stakeholders as well. There was medical teams, rehab providers, as well as their supervisors and managers that were all involved, all discussing best ways to approach return to work, best ways to approach the injury or the illness to avoid secondary injury or exacerbating other injuries. So yes, there is a very clear connection that if they're all in place, all of those, and their social supports as well. So we know that if those social supports are in place, then that reduces and creates a buffer effect for stress. So it can actually help rather than hinder.
Comment is coming through saying absolutely. We'll give it a few more moments. As I said, there's still time for you to submit your questions via the control panel. Please type and submit those questions for our presenter, Kelly McInnes from the University of Tasmania, providing a presentation as part of WorkSafe Tasmania Month. The presentation has also been recorded and will be made available on WorkSafe Tasmania's YouTube page at the end of WorkSafe Month. Seeing no, I was going to say, seeing no further questions coming through. Kelly, you spoke about secondary stress and the return to work process being a causation of that stress. The Act states that psychological illness resulting from the return to work process is not compensable. How do we effectively discuss this with employees?
That's a very good question. It depends on how the injury or the illness is framed. So understanding that that might not be compensable, but there can be re-injuries or there can be secondary injuries that occur as a result. So whilst the return to work experience in itself might be stressful and might cause additional stress, you might find that individuals that are already exposed to that higher level of distress will then therefore experience another injury. And that injury may be a psychological injury or illness, in which case that would be compensable.
And just a comment that's come through, return to work is a responsibility of all parties, a collaborative approach.
I agree 100%. It is not just on the individual that is returning to work, it's on everyone. And the more discussion that we can have surrounding return to work experiences provides more insights into how we can help that process.
Thank you. Question, I have found that sometimes it is difficult to provide support while also remaining firm regarding reasonable actions during rehabilitation and return to work. For example, recently I have managed several workers' comp cases where staff have had minor injuries like sprained ankles and used that injury to remain on compensation for several months, despite there being nothing of note found on ultrasounds, etc. I want to be supportive and avoid causing subsequent injury, psychological distress, but at the same time, I do need to consider the employer's best interests and do not want the claim to drag on without good reason. Do you have any recommendations on how to find this balance?
Again, that's a really good question, and I empathize with you because that is a very fine line that has to be walked. Trying to understand when to have those conversations with people without distressing them is very difficult. But again, I emphasize just that open and honest conversation, and stating the facts that nothing has been found on the ultrasound and that you're wanting to facilitate their return to work, you're wanting to get them back into the workplace. And it's not only for the organisation's benefit, but it's for their benefit as well. I think framing it in a way that's open and honest rather than potentially combative will be a better approach to take.
Thank you. And with no further questions coming through, Kelly, I'll slowly wrap up this afternoon's webinar. So there are some references there, and as I mentioned, today's webinar has been recorded and will be made available on WorkSafe Tasmania's YouTube page at the end of WorkSafe month. So thank you very much to Kelly McInnes from the University of Tasmania, and thank you everyone for attending today's WorkSafe Tasmania month webinar. WorkSafe Tasmania Month is an initiative of the WorkCover Tasmania Board delivered by WorkSafe Tasmania. It is also part of National Safe Work Australia Month. Please head to worksafe.tas.gov.au to find out more about what's happening in Tasmania during WorkSafe Month. We still have in-person and webinars occurring throughout October. Thank you everyone.